Not having the adequate tools to be able to do our job, it's frustrating. It's like a carpenter not having a hammer.
For months now, Nicole Townsend and Kirby White have been putting their lives on the line at the GP clinic in Bendigo.
Have you been feeling short of breath at all?
Sometimes, yeah.
In February, Nicole and Kirby ordered a supply of personal protective equipment, or PPE, for their clinic, including masks and gowns. 2.5 weeks later, they'd run out, as had their suppliers.
We've been able to secure some masks from the stockpile, but to date we've not received any gowns.
We feel like we're at the end of the line of getting distribution from the government sources.
40 k's down the road in Castlemaine, Dr Dan Harbison's also struggling to source gowns.
We absolutely were very low. One of the clinics in town ran out completely. So it really is getting to the stage where it's quite dire.
So Nicole and Kirby took matters into their own hands and started sewing their own reusable gowns.
There's 650 general practices in rural and regional Victoria, and so our goal at the moment is to be able to get a box of gowns out to every one of them.
The pair have recruited an army of volunteer sewers to help, including Carol McCook.
I have been self-isolating and the days can be quite long, and you go for your walk and then once you've cleaned your oven, you think, what am I going to do today? And the gown sewing has been just fabulous.
Over the past few weeks, Carol's sewed 16 gowns.
Probably takes nearly 2 hours for me to make one gown because I want to do them very carefully.
Using donations and small grants, Nicole and Kirby have also teamed up with businesses that are out of work due to the pandemic.
We've engaged a manufacturer in Melbourne who was standing workers down previously. Even we've had a bridal shop come to us because there's no weddings, and so their seamstresses are quiet.
To date, the pair have sent out nearly 500 gowns to their peers in regional practices. The gowns will be crucial as we head into winter, when doctors expect coronavirus cases will spike again.
These gowns, they're not single use, so we know that we can use them as long as we can wash them, and that will give us so much more confidence going into the worst of the COVID crisis.
But funding is an issue, and Nicole and Kirby have struggled to get the backing of politicians and some medical bodies, as their design hasn't been approved by the Therapeutic Goods Administration.
There's not enough time to go through the normal process. By the time that's actually done, there's going to have been hundreds of consultations that needed to happen.
In a statement, the Health Department says it's bought gowns and gloves and is distributing them where required for outbreaks. But Nicole and Kirby say GPs can't wait any longer for gowns.
Now is the time where we need to provide protection to the GPs so that they can keep seeing patients.
What a great idea that is from those two volunteers, and I hope that story shames the government into remembering that out in regional Australia it's often not easy to get this material, and they should get a grant from government immediately.
Yeah, the TGA aspect of it's interesting, isn't it? That they couldn't get, well, haven't got approval for it, and therefore that, like, sometimes you can have these things that are there to protect you.
But as the doctor himself said there, we can reuse these and wash them. I mean, I would rely on the doctor's advice. Get rid of the red tape, and more power to those two. Good on them. That's fantastic.
I'm amazed to see you advocating getting rid of red tape. It's extraordinary.
Surprising. If you are watching this and want to support Gowns for Doctors, the initiative, the links page is on our website. All the details are there.